Ongoing temporary closures of community hospitals such as the one in Shaunavon have been a challenge for the Cypress Health region over the past several months, as it struggles to attract and retain qualified physicians and nursing staff. And although a Swift Current physician has now committed his time to travel to Shaunavon twice per week to ensure service is available at the local hospital, a solid long-term solution is still necessary. Here's where a recent trip out to Nova Scotia comes into play. Cypress Health Region CEO Beth Vachon, along with Board Chair Tyler Bragg, joined representatives of the community of Shaunavon along with Saskatchewan Ministry of Health reps on a fact-finding mission to Canada's East Coast. The entourage toured health facilities in Parsboro, Tagamagouche, and Spring Hill to see how these centers are dealing with challenges of offering 24/7 health care while facing similar staffing challenges, and have now found a solution through collaborative emergency and primary care services.
And in each of those communities, they are operating primary health care sites. And then for their rural emergency services after hours, they have a nurse and a paramedic in their facilities. They don't have doctors on call. They access physicians through the EMS services, their physician oversight for their program, and they are in touch by phone to provide whatever treatment is needed for the patients that come in. In one of the communities that we went to, they had 1,900 hours of closure in their facility in the year prior to getting started with their new model of care. And there has not been a closure in the year that they've been operating. They've been able to keep the doors open with this model.
Janelle Wickstrom lives in Shaunavon and was part of the Saskatchewan delegation in Nova Scotia. Wickstrom indicates that after seeing the Nova Scotia healthcare model, she believes it could work in Shaunavon as well.
By implementing this, we'll be able to see quality, consistent healthcare. It's not going to be the traditional form that we're used to, but it would still give that consistency that we want. And I don't think that anyone would argue that consistent quality healthcare is better than, sporadic disruptions where we don't know if the emergency room is going to be open or not.
And with the Nova Scotia healthcare model leaving a positive impression for those seeing it firsthand, Vachon believes it could be implemented in community hospitals in southwest Saskatchewan and even across the province. However, it's something that won't happen overnight.
It really will be a multi-pronged approach to how we need to go forward and look at this, but I'm very optimistic that there were things they're doing there that we could certainly implement here.
Now that the Saskatchewan group has seen the Nova Scotia Collaborative Primary Healthcare model firsthand, the Cypress Health region will continue to work closely with the province and communities such as Shaunavon to implement a course of action. Southwest TV News will continue to follow this story as it unfolds.